Okay, good evening, everybody. Welcome to tonight's Stride Workshop, part of Positive East Staying In Together programme. Tonight, we'll be discussing research from those living with HIV over the age of 50 years old so we can better navigate the issues facing our diverse community, including coordinating care between primary care and hospitals and dealing with HIV-related stigma. Here to tell us more is Dr. Jake Bayley, who's a consultant and HIV and Sexual Health specialist at Barts NHS Trust for the past 6 years. He's got a passion for gay men's health, PrEP, HIV prevention and HPV and anogenital cancers, and he's also a trustee at Terrence Higgins Trust, who've recently completed an important report into living well with HIV for the over 50s, which I'm part of if you haven't guessed already. Jake, it's good evening, buddy. It's great to have you with us. How are you doing today?
Yeah, thank you very much. Great introduction. Yeah, very well, thank you. Thanks for the invite to come along and talk. It's very nice to be invited to Positive East. So I work in East London, live in East London. I'm very aware of Positive East. I've known you guys for years. Very engaging, so I'm very happy to be here. I think I've got some slides, if you don't mind. It's only a 20-30 minute presentation. I think it's being recorded, so I think we'll do questions at the end if that's okay with everyone.
That'll be perfect, Jake. Fire away.
Fantastic. So let me just share my screen and we'll get cracking. Can everyone see that?
Mm-hmm.
Fantastic. So, as Greg said, I've been at Barts for about 6 years as a consultant. Before that, I did 5 or 6 years in King's as an HIV trainee. So it's been about 12 or 13 years in the field. And I think the biggest thing for me, really, from when I first started, was just the amount of focus on people getting on with HIV. I think it took a while for the HIV community to kind of get to grips with it, really, because the demographics are kind of constantly changing. There's not too many graphs, don't worry, but we're just going to cover a few things. Something about the age groups. They're not a homogenous group. The over 50s are very different to each kind of age bracket. And then something about treatments, medications, a relationship with the GP, which I think is super important. I think sometimes not really kind of highlighted to people about the importance of having the GP as a centre of care rather than the HIV doctors, because that's kind of changed recently as well. A bit about stigma, and then some stuff about menopause, because I think sometimes that gets overlooked as well within clinic and GPs as well. And again, what you can do to help yourself a little bit. So just a very quick kind of starting on a positive note, that actually the UK has probably got the best HIV care in the world, apart from Switzerland, I think. So the UN set these targets of 1990, I'm sure you've all heard of them, of 90% people diagnosed, 9% on treatment, and 90% of those are on treatment who are virally suppressed. And I think we've passed all those for the last 3 years in a row. So we're doing very well. So living with HIV in the UK, compared to other countries, is quite advanced and quite sophisticated. We've got a very good kind of monitoring system. The PHE, or used to be PHE, now the Health Security Agency, are very good at kind of following people around so that people don't get counted twice. So the UK has excellent HIV care. However, we can always do better and do more. And I think hopefully after today, people might have a bit more of an idea of what direction of travel we're going to go in, hopefully. So just to let you know, obviously people back in the 80s and 90s were generally younger people who were sexually active. When the test came in the mid-80s, obviously a lot of people were getting very sick and dying. These days, since the mid-90s, 1996, since effective treatment came in, obviously people are living longer. And people living with HIV now have the normal life expectancy as someone living without HIV. There was some research done recently showing that people living with HIV actually live a little bit longer because they get monitored so regularly. All the problems are picked up that people would normally kind of, forget about. So essentially the direction of travel, which is a bit of a, hopefully not too complicated, but the bottom is the time, the year. So we go in from 2010 to 2040. And on the left is the proportion of people who are living with HIV and their age. So at the moment, you can see in 2010, it was about, 20% were between 50 to 60 and over. And if you go all the way to 2040, which is not that far away, it's only 15 years away, about 90% of people living with HIV are going to be aged over 50. So it's up to the HIV kind of community to really kind of take this on board, and the doctors and nurses in the clinics to really kind of see what we can do to best help this kind of group. It'll be the majority of the patients living with HIV in the next 10, 20 years or so. So the over 50, it's really diverse. I mean, they're not the homogenous group that people probably think they are when they talk about people over 50. The first decade, 50 to 60, people are still at work generally. People are worried about financial worries. But again, lots of people are on kind of living on benefits, which is more so in people living with HIV mainly because of people who were diagnosed early before treatment and had lots of comorbidities and problems, and have struggled to find or to get employment since. Essentially, the good news is that as you get older, though, the happiness does increase. And these figures are taken from the THT report, which is called Uncharted Territory, which asked about 300 or 400 people aged over 50 living with HIV around their experiences of living with HIV. So the good news is that once you get over 65%, about over 3/4 of people define themselves as happy, somewhat happy, or very happy. So it seems that 50 to 60 is a bit of a dip, and then you get happy as you go through, which is kind of reassuring, isn't it? So I think the most common thing we get at work or in clinic when I talk to patients is about medications. And I think this is probably the biggest thing that people struggle with. So essentially, obviously, people living with HIV are going to have other morbidities, which we'll come on to a bit later on. And I think people tend to have more kind of other medical problems compared to people living without HIV. And that means more tablets, essentially. So the tablets, when I first started, 10, 13 years ago, were pretty unforgiving. If you missed a dose, the protease inhibitors were pretty full on side effect wise. Then the tablets are much better now. The ones we have now have fewer side effects. They're much better tolerated. The problem is that some of them can interact with other medicines as well. And that's probably one of the main problems we find as a doctor in clinic about people having tablets from the GP who's unaware of these interactions, and also things over the counter from the chemist. So there's a very common nasal spray which contains a steroid that if you take a protease inhibitor with, it can make you quite sick. And we've had a number of people who kind of come in with quite a very high steroid levels from taking the protease inhibitors plus the nasal spray. I think the biggest problem when people go to the pharmacy and get these things and the pharmacist asks them about their medicines, people are too embarrassed or worried or stigmatized or scared to say they're living with HIV and tell the pharmacist about the other medications, which obviously can affect the interactions as well. And also the GPs as well are also kind of can get a bit panicky about the medications and interactions and probably kind of over-treat or under-treat in certain cases and put everything down to your HIV. So I think it's really important in this case, especially to be very aware that you need to tell your GP, if you go to A&E, if you're unfortunate to go to A&E, if you go to any kind of pharmacy or any kind of over-the-counter kind of supplements, you have to kind of tell your HIV doctor and pharmacist, because even the things like protein shakes and creatine, iron supplements can interact with the medicines quite significantly. So it's really important that you just tell everyone, but I appreciate it's not always easy for people in a busy pharmacy, for example, to say they're living with HIV and tell people, but it's important to at least tell your HIV pharmacist or HIV team if you do. And I think the problem is as people kind of get older and the hypertension starts, the blood pressure, possibly type 2 diabetes, other things continue, the number of medicines will continue to go up and the number of pills you take a day. So it's quite important to get a pharmaceutical review every time you go to your clinic. So when you go and see a doctor, you should have a pharmacist review your drugs and interactions, and that happens with every patient at Barts. But it can get quite tricky if there's different things at different times, and sometimes you have to prioritise some of them. So it's really important to let the doctors and nurses know if you start any new medications. So this kind of comes down to the coordination of your care. So 10, 15, 20, even 30 years ago, when HIV care was totally different. It was your main doctor was your HIV doctor, and you went to your HIV doctor of everything from blood pressure to cholesterol to diabetes. Everything was managed generally by the HIV team. About 10 years ago, the government, in their wisdom, introduced a reform, which meant that basically the GPs have all the money, all the cash. So everyone gets a certain stipend per year off the council or NHS England for their care, and the GPs hold that money. So it's no longer financially viable for the HIV team to then treat all these conditions because the GP gets paid for it, essentially, sad to say. Essentially what happens is the HIV team, we now are only led to look after HIV and related issues. So I remember giving out people antidepressants and treating all sorts of manner of kind of complicated things. But now we're just not allowed to do it. The pharmacist will review your work and say you can't give this out if it's not related to HIV. So the problem is it then leaves people in a bit of a limbo situation of where do you get all your care? So the trick is it's going to have to be your GP. But the problem is that GPs are majority very good and excellent. As you've noticed in the press recently, they're getting a bit of a hard time. And the reason for that is because the number of face-to-face appointments has gone down purely because of the pandemic. But the GPs that I know, and I saw, in fact, talking to one this afternoon about it, they have never been so busy. Their demand is off the chart. So it leaves people in a bit of a tricky position. If you've got something wrong with you or you need some care, and the GPs are busy. Where do you go? And it's very difficult. And the HIV team are generally there to support if you need some help around something that's to do with HIV or not. But it's very, very tricky to kind of get an appointment for the GP. So it's tricky for everyone at the moment. I think the GPs can coordinate care, but a lot of people still haven't told their GP for fear of stigma or retributions. And that was, again, back in the 80s and 90s when life insurance was higher and people were less educated and understanding about HIV. So it's super important that everyone tells their GP. And that's the reason is if the GP comes to you at 2 in the morning for a home visit, you're not very well, and you're on HIV medications, and the interactions may be so that they may not realise and it may put you in more danger. So it's really important that everyone tells the GP. But again, getting a good GP who understands is, again, tricky. And, you know, good GPs are the majority. There are GPs with special interests in sexual health and HIV, especially around Newham as well, and Tower Hamlets and Walthamstow. And if you can find them, they are very useful, because I think a lot of people who aren't exposed to HIV in their day-to-day work still have their knowledge from medical school, which may have been 20, 30, 40 years ago, and may have very outdated views about treatments and people living with HIV. So I think the main thing with this is if you come across any kind of issue with a GP or a doctor, you should, one, flag it to the clinic manager, because that needs to be addressed. And also as well is change your GP. I mean, I'm very, very big fan of changing GPs. If you're not happy with your GP practice, or they've treated you poorly, or you think you're being stigmatized, just change your GP. It's that simple, until you get a good one. And then the point about the stigma is the stigma needs education, and educating a group such as GPs is done regularly, but as you imagine, they've got a lot of things to kind of be updated about. They're very general kind of things, blood pressure, diabetes, etc. So training, we do a lot of training for GPs at Barts. We've got a program which gets paid for by the council, where we go in and teach GPs about HIV, living with HIV, medication interactions, etc. But a lot of GPs also, if you go with a problem, may just put all the problems down to living with HIV. And I very regularly get emails from GPs saying, oh, this person's got X, Y, and Z from HIV. And it's not HIV. They've been undetectable. They've got a good CD4 count. It's generally just a normal general medical problem rather than HIV. So again, but these are all barriers for people attending GPs, which obviously as you get a bit older may become more frequent. So I think that the lack of the same GP, which used to be a very historical thing, has now changed as well. So having a different GP every time you go is kind of normal now, which can be, again, repeating the same story of your history, what tablets you're on, and also giving conflicting medical advice. If their knowledge is about 20 or 30 years out of date, then the knowledge or the information they're going to give you may be incorrect. So it's important to just double check with the HIV team about whether they're doing the right thing, so essentially. And I think most HIV doctors or nurses would be happy to give you some advice if you called the clinic or emailed them, definitely. So I think the whole point of the GPs is it needs to be better integrated into the hospitals and when you go and see your HIV doctor. The next thing about GPs is if you're over 50, you should be getting invites to get a health check. And these are really, really important. And this is basically like a screening program for anybody aged over 50, between the ages of 50 and 74. Every 5 years, you will get invited to the GP for some blood tests and a blood pressure reading. And that's basically picking up anything like diabetes, early heart disease, which can be treated, any kidney problems, and the risk for stroke. So it's kind of reducing your factors like smoking, making sure you exercise, making sure your blood pressure is okay. So if anyone were to get an NHS health check appointment, I definitely recommend going to see them. So the HIV service will do these tests as well, but we're not as experienced as looking after and interpreting these tests as your GP is. I think that's where the problem lies, is that actually we do a lot of these tests, but sometimes they kind of get overlooked in favour of looking after your HIV and your viral load, etc. So it's definitely worthwhile if you get invited to the health check to go along and see if they can kind of highlight any issues that might be brewing, or at least try and modify some of the risk factors for the different things. So this is just showing that as we get older, on the bottom line, there's a different age group. So on the bottom, you've got 50 to 54, 55 to 59, etc. And then the number of people on the left, and then as you can see on the bottom, the number of people with common comorbidity, that means other health conditions at the same time. So as you can see, obviously, as we get older, people are going to have more health conditions. And these are generally things like increased weight, obesity, heart problems, strokes, diabetes, and blood pressure. They're the kind of the top 5 main things. So as you can see in the far right bracket, there are only very few people with no other, only about 1 in 5 have no comorbidities. And so 80% of people have one other problem or medical problem, which they'll probably see the GP about unless it's a specialist kind of diagnosis. So I think the GPs are really important to kind of help you kind of navigate the other medical conditions, not just the HIV. So, and hopefully your HIV doctor should write to your GP after your appointment, and we say about once a year. And if they don't do that, you can ask the doctor and they'll tell you if they've written to the GP recently. People living with HIV have 3 times as many health issues compared to the general population, and that can be for a number of reasons. I think a lot of this data was taken from people who were diagnosed before the advent of effective treatment, when the HIV and the older drugs kind of had a bit of a negative effect on people's bodies. And people report low levels of well-being in people living with HIV compared to people without HIV. And that's mainly because of the extra stress, the extra pressure, the stigma, the loneliness, and basically taking more medicines and having more doctor's appointments than people living without HIV. Not everybody, obviously, but a lot of people still struggle living with a diagnosis. And the struggle manifests itself in different ways. So we've already discussed the stigma around from healthcare professionals, which is very real and still, sadly, a very real factor in hospitals and GPs around the country, but also self-stigma. And this is a real barrier that we find for patients. So I had a patient on Monday whose daughter went for a vaccination and then stopped the daughter from going to the vaccination because she was worried the doctor would tell her about her HIV status. And this is a very common kind of thing that we find in clinic, is people are terrified of, their diagnosis being disclosed inadvertently to friends or family. And I think in other settings away from HIV centres or GPs, for example, are a bit more sensitive, these things can get disclosed easily, and it's a real issue. So people living in care homes, people a bit older, have had their HIV diagnosis disclosed against their will. Other care settings. So it's really important that, people are very careful with your information, essentially. And then also people who are in these kind of settings that aren't very educated or aware or up to date about HIV use inappropriate measures. So there's been reports of people being confined to their room, that people use double gloves, people wear masks for no reason. So it's all very difficult, and that kind of reinforces any stigma people have around their HIV diagnosis. The stigma is more pronounced, we find, amongst kind of the Black African population compared to gay men. And when you talk to patients from that particular population, especially people that look after quite a few pregnant women, so for example, breastfeeding. Breastfeeding used to be quite a difficult conversation, because obviously if people are undetectable, they can now breastfeed with monthly viral loads. But 5 years ago, people weren't allowed to breastfeed. And in the African community, that was seen as a very much of a signifier that people were living with HIV. It's almost like a non-verbal cue that people live with HIV. So people, we had to tell people to lie that they got mastitis or inflamed, or they couldn't produce milk, or they had an infected breast, etc. So all these things kind of feed into this kind of stigma that people may have living with their HIV. And again, people who have less financial security also face more stigma as well, because of the higher rates of anxiety, depression, etc. So this stigma can only really be kind of tackled really with kind of a nationwide kind of education campaign, really. And I think THT, Positive East, NAS, all these HIV charities, NAT, are all very good at kind of educating and doing campaigns. But the rates of ignorance around HIV is still sadly very high. I think the most kind of heartwarming or optimistic thing I've heard recently is that sex education in school, which contains bits about HIV and STIs, is now mandatory in all schools, but from about 2 years ago. So I think this generation, at school now, will have a much more open and educated kind of awareness of people living with HIV and other STIs as well. So I think this will eventually kind of improve. At the moment, it's still a very real issue, and people still struggle on a daily basis. And the problem with the self-stigma is that the language used in media is not very pleasant and a bit unfair and not very kind of up to date. So we are very good at kind of flagging these things. So Positive THT, National AIDS Trust will pick up, any articles on the Daily Mail, for example, and correct them in the Sun, etc. And they do get corrected, but unfortunately, once they're out there. And the use of language is really important around trying to reduce stigma. So we've now stopped saying people who are HIV infected, because it's not a very nice phrase. These people live with HIV, but again, these kind of other people that are unaware of this language use still use stigmatizing language, which does not help the situation. So this is probably an issue that doesn't affect a lot of people. However, it can be an issue in people who are a bit older, their friends have kind of gone away, they've moved away from their social circle, for example. The social isolation is not for people living with HIV at all. This is a very real issue across the country. And I think if you remember the MP Joe Cox was sadly murdered a couple of years ago, they introduced a Minister for Loneliness in the UK government, and that they're doing very good work around trying to get people out to groups and things and other groups. And I think this is really important that actually since the pandemic, I think this has probably only gone up because of the lack of social kind of interaction. So I think it's super important as people living with HIV, if you know anyone who may be a bit lonely or a bit isolated, give them a call, arrange a coffee morning. PHG are very good, possibly are very good at organising these social events, but it's up to everyone really to kind of help, people within the community. So obviously, a large proportion of people living with HIV in the UK are women, and I think sadly, I don't know why this is, but they have low levels of well-being when compared to men. By quite a good margin. So only about over a quarter of women said over 50 they felt their well-being was good or very good. And I think if they're not at the age where the kids are still at school, I think they have issues around caring for family members, mainly children or elderly parents, etc. And I think another big one that is not really discussed, which should be discussed in clinic, and I try to do it with all my female patients, is the impact of the menopause. And I think people aren't very good at going to the GP about menopausal symptoms. People think it's kind of okay to put up with, the hot flushes, the forgetfulness, feeling a bit lethargic, when actually the GPs are very specialist and can give you some support. And if you feel like your GP would not help you, your HIV doctor will definitely be able to give you some support and some help. And we run an HIV menopause clinic at Barts, for example, which is very popular and has a big impact on people's symptoms and people's lives. So please don't suffer in silence. Please go and speak to someone about it because it's super important. And I think it may explain why people have lower levels of well-being, because people put up with these symptoms for a long period of time without seeking support. People living with HIV have higher rates of poverty as well. And again, this is from the fact that there are more people living with HIV compared to people without HIV, living on benefits and living kind of on disability benefits as well, which, as we know from the budget today, is still kind of at very low levels. So I think it's really important to and the hardship funds for the charities are very useful. And then we see a lot of patients who are going through kind of the PIP or the assessments, which can be extremely stressful. There are horror story after horror story about people being treated very poorly. We write letter after letter for patient support. Our letters used to hold quite a lot of weight. These days, unfortunately, given the current climate, they're less so. And I think if you have an issue with your PIP or you're not happy with the result, it's really important that you talk to your HIV doctor, because we can make a few phone calls and hopefully sway things in the right direction. No guarantees, but we do still have a bit of sway or influence within kind of the process, but it's getting less and less sadly as the times go on. And a talk wouldn't be complete without a bit about COVID. It's only a couple of slides, don't worry. I'm sure you're all sick of hearing about COVID. I think there was lots of data. So when it first came out, there was lots of panic people, it's an infection, will it affect me, living with HIV? And the number of trials that were done, I mean, the databases on research on COVID, it's millions of articles a year, with quite a few people living with HIV that were very small samples, and some of the results were a bit kind of, well, quite frankly, terrifying and not very helpful. I think essentially the most important thing for COVID is obviously things like increased weight, a very low CD4 of less than 50, which I think very few people thankfully have these days, and a recent organ transplant. So a lot of the people living with HIV are undetectable and their CD4 counts are over 50. So I think that the biggest trial in the UK showed there's no increased kind of severity or death for people living with HIV compared to people without HIV, as long as you get your vaccine. Which leads me nicely to the fact that everyone who on this talk, if they're over 50, is now eligible for a booster. And all you need to do is literally Google. I googled this last night, and Google that, and then go on there and book your booster straight away. That's probably my public health message for the afternoon. It's very straightforward. There are centres all around East London or across London in general, and the booster is just as effective if you're living with HIV or not living with HIV. So it's very effective and protects you at least against being hospitalised and being very sick. So I definitely recommend getting the booster. So to wrap it up, it wouldn't be a doctor's talk without the 3 top things that we tell everyone at work, essentially: stop smoking, exercise more, and eat more fruit and veg. Ensure you take HIV treatment, which is very straightforward. The other one, get involved in your patient group at the clinic if you're interested. We have one at Barts, and it's very important to hear people's voices about how you want your care kind of delivered to you from now and in the future. And it really does have a lot of weight, and we do listen to people's opinions about how they want their care delivered. It's really important to get involved if you're interested. But also get involved in charities like Positive East, THT, etc. Get involved in peer support groups, kind of like to reduce any loneliness, or people that kind of feel a bit kind of on the fringe of society. And then pick up the phone to your peers who you may think might be a bit lonely. And then also, it's really important to talk to your clinic or your doctor or your nurse if you've got any worries about anything, because a lot of time people suffer in silence. We are very busy, but everyone's very busy, but we're not too busy to take queries from patients who are concerned. I think a lot of our job is reassurance or giving advice, which is exactly what we're there for. So please don't suffer in silence and just come and have a chat with us. And that's pretty much it. Thank you very much, everyone.
Okay, can you see me? There you go. Jake, that was a fantastic presentation. Thank you so much for with really useful information, and I know as I fall into that category myself, I found there were loads of information that was relevant to me as well. Just like to make a point, if anybody else needs support with PIP applications, as Jake mentioned, we also provide that service at Positive East, so you're more than welcome to come along and register for that service if you're not with us already. Apart from that, I'd like to say that was amazing. Thank you so much, Jake, and thank you for all the love and care that you've shown our communities. I used to see a lot of clients who attend your clinics, and you and your organisation very much loved, so thanks very much for that.
My pleasure, and absolutely thank you as well. It's a